Hi guys, welcome back to my channel, and today we're going to talk about Invisalign. So 10 things you should know before you start your Invisalign treatment. First of all, Invisalign are made of those clear aligners. You need to have the commitment of time. So Invisalign, you need to wear those little clear aligners for at least 20 to 22 hours a day. Now, it is okay if you go out for dinner, for example, or you forgot your liners for a couple of hours. That means you just need to put that extra hours back into your whole treatment time. So for example, if you wear the liner for 1 week and you forgot it for about 2 hours, and then you need to wear that 1 week plus 2 hours to make up for that lost time. Yeah, so commitment of time. If you can't commit yourself for 20 to 22 hours wear of liners every day, then perhaps it's not right treatment for you. Number 2, how do I eat with Invisalign? You don't eat with Invisalign, so you take those tray or liners out during meals, and you can drink water, light colored tea, or a Sprite even, for example. You can drink those liquids as long as they are clear and not colored. But if you're drinking coffee or Coke, for example, you need to remove your liners. That's because those liquid gonna sit between your liner and teeth and make your teeth look like funny color. So yeah, that's how you drink and eat with the liners. Number 3 is, how do I speed up my treatment? Because often my patients have long treatment. For example, they've got 30 or 50 aligners. Now the trick to speed up your treatment is use these little things. They are called munchies. So essentially they have got those grooves on them, and then what you do is that you munch your teeth with the liners on them, of course. Then you munch into those little grooves and chew 15 minutes for about 3 times a day. So that will actively push your liners up into the teeth and push onto the ligaments around the teeth and make the teeth move faster. So that's a little trick. So all of our patients using Invisalign, I tell them to get this stuff, and then they can go on liners for 7 days and change to the new one very easily. So that can halven your treatment time by changing your liners potentially once every week rather than once every 2 weeks. So the next one I often get asked about Invisalign is what is attachment. Yeah. So people need to know a lot of Invisalign treatment planning will add attachment to your teeth. So let me show you a close-up of attachment. It can be very hard to see, but they look like the little buttons. You can see one right here, little buttons on the teeth, and those are tooth-colored bonding material, if I put it that way, that stick onto your teeth during the time of Invisalign treatment. And how they act is like handles on pots. So they try to turn and move your teeth as well as roots of the teeth more predictably. So there's greater surface area for the liner to grip onto them and move your teeth. So attachments are usually used in the area where complex movement or the root of the teeth needs to be moved and tilted as well. So ask your dentist about where your attachments are. During the clean check, which is the setup appointment of your smile, your dentist should know where the attachments are, and then before your treatment start, you know where you're expecting them. The good news about them is that they're relatively small, so the liners have the space that accommodate for the attachment. Once again, I'll try to show you a close-up. So it looks like that. See that space? So liners go on top of the attachment that's glued onto your teeth. But at the end of the treatment, simply your dentist just remove those attachments. Attachments or around the attachment should be highly polished, so it doesn't attract any other staining from your food and drinks. People with Invisaligns often require to have some IPR done. What IPR stands for is interproximal reduction. That simply means if you're struggling for space and you've got a lot of crowded teeth, we need to create some space between the teeth. And that's done either by dentists just trimming between the tooth very, very carefully and very, very precisely. The maximum I usually go for the trimming amount is 0.5 millimeter between two teeth. That means it's 0.25 millimeter trimming or polishing between on each tooth. Now, if you have 6 lots of 0.5 millimeters IPR, that means you're going to gain 3 millimeter of space to align those crowded teeth. So they are quite useful. And now with IPR, I always do it under a microscopic vision with my very strong light attached to it, so you can see where you're going, because if it's not done well, it can cause roughness between the teeth, potential area to develop decay and holes in your teeth later on. So that's quite important as well. So number 5 tip, remember, it's IPR, stand for interproximal reduction, and you will possibly needing that if you have very crowded dentition to be corrected. Number 6 tips. Invisalign people always get asked, look, is Invisalign right for me? Should I go for braces? In a lot of simple cases and moderate cases, Invisalign will give you the same result as what braces can deliver, so that's a good thing. And this newest research shows in very selected cases, Invisalign actually achieve faster or achieve the same result with faster treatment time. So that's certainly something, it's good for everybody. But in some complex cases, which Invisalign itself and a lot of research paper shows as well, so for example, if you have multiple teeth extracted, try to close that extraction space with Invisalign can be challenging, or you won't get a good result, or you spend a lot of lengthy time on it. So that's the time you should consult with a dentist / orthodontist to discuss your options and which one going to give you a better result. In general speaking, braces have that 3D control of the tooth and have greater control of the forces. Hence, in complex cases, braces are often a better option. But it's not saying, look, Invisalign can't deal with complex options. We've done cases with Invisalign, that's a complex case. You might need accessories such as little anchorage point here and there to help to pull the teeth a little bit faster. So that's doable as well. So make sure you speak to your dentist and orthodontist so you know whether your case is suitable for Invisalign. Tip number 7 is elastics. So a lot of people say, elastics, what are they? So little rubber bands, and they're hooked between top and bottom jaws that helps to reposition your teeth / jaw. Yep, those elastics that you're often required to wear them all the time, except eating, and you need to take them out just like Invisalign liners during brushing and cleaning teeth. So elastics are often we call it accessories of Invisalign. So they're simply small rubber bands like a hairband, but very, very small version of it, and you just put them on. So tip number 8, refinement. Invisalign is a digitalized aligner, or I should say digitally designed aligner that's gonna move your teeth. But hey, everybody can be slightly different. How the body reacts to force are different. That's why during braces you will often hear finishing period by your dentist or orthodontist, basically just to refine the last little bit of movement. Invisalign is the same. So when you have finished your first set of trays, during the treatment or at the end of the treatment, you might find 1 or 2 teeth didn't move according to how we planned it to be. So what we do is we take your scan of your teeth. So we don't do, those messy molds anymore. So we use 3D scanners, scan all of your teeth, and that directly sent to Invisalign, and that will give you the refinement or new additional aligners just to finish off that last bit of movement for you. So that's why refinement is often, needed in some complex cases. But having said that, if you wear your aligners well and use munchies, most of the time you'll get away with just with first set of aligners. Now, I get asked by a lot of patients, do you get charged extra at refinement? How do I pay for this? Usually in our practice, when you have 14 aligners, you don't get charged. by getting Refinement. So there's 2 sets of refiners that's free of charge. In comprehensive aligners, that means aligners, you've got 14 plus aligners but less than 26 aligners, all those refinements are free of charge. Invisalign simply promises they will move the teeth as how we design it to be. Tip number 9 you should know about Invisalign is, when you finish Invisalign, do you need retainers? The answer to that is, of course, always. So regardless of whether you're using conventional braces system or Invisalign system, the minute you take out that active force, whether it's from your aligner or braces, the teeth will start to move back. And that's because the ligaments around the teeth have memories, and they try to shift those teeth back to the original old position. So retainers are an essential part of treatment. If you want your teeth to be as straight as the day one you removed your liners 4 years down the track, for example, you'll need some passive force to hold everything together. So there are different forms of retainers, which I'm going to explain to you in another video, which is called retainers, question and answers, which is link is here if you want to go and have a look at that. So basically, yes, you will need retainers, and depends on your movement and complexity of treatment, you might need your retainer 24/7 to wear for the first 6 months or even longer. Yeah. So talk to your orthodontist/dentist what form of retainers they provide and what's best for you. Obviously, there's different, hundreds of different types of retainer forms. So speak to them, say which one they use, whether you like, and choose one that fit into your lifestyle. Number 10. It's a very common question I also get asked by my patients, is that during the Invisalign I feel my teeth are getting loose, and also I get food stuck between my teeth. And that's very common. Once again, that's because your teeth are starting to move, and you've got to have that freedom for the teeth. They can't just be sitting against each other so hard that nothing can, it's getting jammed, so it doesn't move that way. So there's going to be a very small space between the teeth. It's actually normal. Teeth are moving, that's why you get that space. And how we get around with that in terms of food impaction, you can either use floss or something like a little brushes, like pixters I call them. So they're like bottle brushes, but they're very small, very easy to carry. I'm showing you size 1 there, but you can go down to size 0, which is even a smaller, finer tip. So just to brush between your teeth. For example, you're at work, finish your meals, just brush between your teeth and have a good gargle out, then you'll clean everything out. So that's a very handy thing to have in your pocket. Yeah. So so I've talked about 10 little things about Invisalign, very common questions usually I get asked by. Look, if you have any more questions, feel free to comment below and visit our website. So it's always a lot of good information. And remember, subscribe to my channel, and you will always get very useful tips about how to keep your teeth healthy, how to use your Invisalign, and loads of information. Well, till then, have a great day, and I'll see you next time. Bye.